Everything funded through the Behavioral Health Services Act, or what we call BHSA, requires a community planning process to determine how the funding is spent. The community planning process brings together a broad range of stakeholders to gather input about mental health and substance use programs and services.
The goal is to identify unmet needs and service gaps, as well as figure out how best to address the mental health needs of all the different people in Los Angeles County. The community planning process is the basis for drafting 3-year expenditure plans and annual updates. Let's walk through the process step by step.
First, the community planning process includes a community planning team. The team represents a diverse set of stakeholder groups with particular attention paid to making sure people with lived experience, such as users of mental health and substance use services, family members, caregivers, and peers, have a voice in how the plan is shaped.
The community planning team in LA County has more than 120 available member slots, representing the county's diverse demographics to plan for mental health and substance use services. Conducting a community planning process offers meaningful engagement opportunities for stakeholder groups to provide input and generate recommendations while offering equitable support to ensure participation for all groups. Are you still with us? Here we go.
The process includes 5 phases. Phase 1 is stakeholder input. This is where the Los Angeles County Department of Mental Health team shares a county-wide needs assessment. This includes information on the culture, language, ethnicity, and mental health service needs for different regions in LA County.
The needs assessment also focuses on how many people are served and where there are gaps for mental health and substance use services. Following this needs assessment, all the different people and organizations from across the county have a chance to share their perspectives on what's important to them. Phase 2 takes stakeholder recommendations. This is where the stakeholder groups come together and discuss their various priorities and how they should fit into the plan.
Phase 3 is an important one: consensus and closing. In this phase, the stakeholders come to an agreement with a draft of their plan. Next, Phase 4 is public posting, public hearing, commission hearing, and approval. The proposed plan is shared with the public and relevant county agencies for their input and to identify any updates or revisions that need to be included.
Once that input is included in the plan must be approved by the Los Angeles County Board of Supervisors, then submitted to the State Department of Healthcare Services for final approval by June 30th of every year for implementation on July 1st. Once approved, the plan is ready to be implemented by the LA County Department of Mental Health.
Finally, Phase 5 is implementation, monitoring, public accountability, and information gathering for future planning. In other words, the plan is put into action, but the learning doesn't stop there.
We listen to the people we serve to better understand what's working and where things can be improved. All of this information will be used to inform future plans and annual updates to the current plan.
If you have ideas or input, we would love to hear from you. So please visit dmh.lacounty.gov to learn how you can get involved.